I think it just presents an opportunity. I think the way that shared decision making works best is if you empower not just the practice leadership and the clinicians, that there is a tool that they can give their patients to learn more about different treatment options, but if you engage the staff. So in our practices that we work with, it's really important for the staff to have the opportunity to figure out how to implement the tools. I mean, I think that's what really happens is in the clinic is the clinician sees an opportunity to share information, but the way that gets into play is through such a more dynamic system of support, and changes in that support system across the practice have to happen in order to make the tool available. At one of our pretty remote practices, one of the physician assistants had a patient come in who was a chronic pain patient, and she was reporting to her colleague that she was a little nervous before the visit. You know, the patient would come in and she didn't know how she might help cure this individual. And so she knew she had the decision aid on chronic pain. She felt it was an opportunity to share it with him and ask him to watch it and come back in. She also worked with him some to adjust his pain medications. And when the patient took the video home, eventually when he came back in for his appointment, he said, well, I watched the decision aid and I'd like to see a pain specialist. And so the clinician was able to connect him with a consult in the closest pain clinic, which is 2 to 3 hours away. The patient went and he returned to the primary care clinic afterward, and he reported back to the provider that although they had done a lot of work at the actual pain clinic, he was more satisfied with the process that he had started engaging in with his primary care clinician, and that he'd like to just, instead of going for future referrals, continue to work with that physician assistant to help adjust his pain, and that the work he'd done had actually made the pain the most controlled that had been. So now it was on a 3 out of 10 versus the 8 out of 10 that it had been initially. So I would say we're still working on the measurement, but for the definitions of success, one of the things we did with our practices before we started implementing the DAs was to meet with focus groups of clinicians and staff and to ask them, participation in this project, how would you define success? And it was very surprising that both clinicians and staff said, well, having informed, happy, healthy patients. So not just the clinical outcomes, knowing that more people were getting diabetes labs or that more people were getting appropriate testing for their preventive services, but that patients actually felt like they had the knowledge to make choices and that they were part of that care team. I think there are 2 PSA stories that are appropriate. The first is basically one of the clinicians had a patient who was eligible for the PSA testing, and she offered him the DA 3 to 4 times, she said, and he declined each time. And then about 2 weeks later, he actually came in requesting to see the PSA tape, and he viewed it with his wife, and then was able to come back in and say, you know, I'm not interested in this test right now. And so sometimes the timing's not right to offer a decision aid, but having the opportunity there, making the offering and then letting the patient, when they're ready, come back in is, I think, an important aspect of the implementation. I think that the way that relates is it takes time to educate patients about the role they have in the process of making medical decisions. So even if your patient is informed in general or highly educated, they might not actually realize that even in the medical context that they're still an active partner. So I know one of the staff at the clinic, when they were choosing their decision aids, they gave her the PSA testing DA to go home with to watch, and she watched it, and she came back in and talked to the provider and said, I still don't understand it. I don't understand why you watched it. Or you had me watch this to consider the treatments my husband might go to or the tests that my husband might have. And the clinician said, well, that's the whole point, is that there isn't clear evidence one way or the other. And so the challenge is to present patients with that information so that they can make the choice. And she kind of paused, and then she said, oh, now it makes sense. So I think it's an example of how it's a process. It's not necessarily that you hand out the DA right now And it's a matter of balancing it where the patient is at and using it as a tool to educate them as an equal partner in that relationship. I love working with my clinics and the communities. I like when I'm able to offer support to the practices as well as to connect them. So my favorite thing is if somebody is working on choosing an electronic health record system or figuring out how to implement care management or to figure out how to use new tools in their practice. If I know there's a clinic that already is doing it well, how can I connect them, or how can I go to the clinic and help ask those questions that get them to the stage where they want to be at. So that opportunity for interaction is really the best part of the job. And for, I think, engaging the right staff members in the decisions too. A lot of times when we think about practice change, you have to have the buy-in of the top leadership, but you also have to have the buy-in and the engagement across the whole, everybody in the practice. And so finding ways to help identify champions at all levels and to give them the confidence to embrace the change or rise to the challenge of doing something new. One of our clinics is it's part of a hospital health district, and so they're really in some ways dependent to having the population appreciate the work that they're doing so that they support the levies to continue funding the project. And so one of their reasons for participating was, in addition to having healthy, happy patients, which they said was also to have a positive response by the community. And so, for example, one of their ways they would know that that had happened was that if they gave, say, a decision aid about PSA testing to a patient, and then a wife or a family member came in, you know, later on, a week or two later, and said, I hear you gave out a decision aid on this topic. I'm interested in menopause. Do you have a DA for me? That's how they would know that they had had success in the project.